This is Greg Purcell, James Madison University nursing student, discussing my Tell the World project on CAR T-cell immunotherapy for acute lymphoblastic leukemia. CAR T-cell therapy was previously only used in clinical trials prior to 2017 when it became FDA approved for children and adults under age 25 for acute lymphoblastic leukemia who have not responded to cancer therapy or who have relapsed after stem cell transplant. It's not really a drug, but it's an infusion of genetically modified T lymphocytes to boost cancer fighting capability. The picture to the right is a leukemia cell in the bloodstream. ALL is a B lymphocyte malignancy, which creates immature B cells known as blast cells, and they multiply and overcrowd in the blood and bone marrow and cause leukemia. Some of the signs and symptoms are anemia with fatigue, thrombocytopenia with low platelets, and neutropenia with low white blood cells and infection potential. ALL is the most common form of cancer in children under 15. B lymphocytes are a type of white blood cell that become plasma cells, and they make antibodies to fight infectious invaders. B lymphocytes are differentiated from bone marrow, lymphoid stem cells, and lymphoblasts. B lymphocytes and plasma cells also make up the humoral immunity portion of the immune system and live in the lymph nodes. T lymphocytes, it's a big picture of a T lymphocyte on the right, are also white blood cells and cousins to B lymphocytes who evolved from lymphoid stem cells and from the thymus gland and lymphoblasts. T lymphocytes are members of the cellular immunity system, and T lymphocytes, along with natural killer cells, can directly attack and kill cancer cells and viruses. Also, in cell-to-cell contact, T lymphocytes can communicate and stimulate cytokine release. Anti-CD19 CAR T-cell immunotherapy identifies clusters of differentiation protein antigens on the B cells that are unique to the B cells, but found on healthy as well as cancerous B cells. CAR receptors are the body's own T cells genetically modified to express anti-CD9 receptors to attach to cancerous B cells. CAR T-cell therapies improve the body's ability to detect and kill cancer cells. And it's based on the concept that immune cells or antibodies can recognize and kill cancer cells. This is a diagram of genetic engineering aspect of CAR T-cell immunotherapy. Monoclonal antibodies are, as targeted therapies, help construct the CAR T cells. This diagram shows CAR T cell receptors are fusion proteins that contain an antigen recognition moiety and a T cell activation domain. The anti-CD19 receptors bind to destroy the malignant or CD-positive leukemia cells. And this is a bag of CAR T cells waiting to be infused for immunotherapy. The treatment process summary is involved in this picture. T cells are collected from the patient or from an allogeneic source. T T cells are genetically modified in the lab, and they are re-engineered and multiplied and reinfused back into the leukemia patient to kill the cancerous cells. The potential side effects for CAR T cell immunotherapy includes cytokine release, which is inflammation and can include hypertension, high fevers, infection, and low oxygen saturation, as well as B-cell aplasia, which is death of the normal B cells as well as the cancerous B cells, and tumor lysis syndrome, where metabolic components from the killed cancer cells are released into the system.